Joanne,
Hi, I'm Reed McKee. I'm your student nurse today. How are you doing?
I'm awesome. How are you?
I'm doing great. Thank you so much for asking. Yeah, no problem. I can wash my hands. All right. Now, can you please say your wrist, your name tag? Can you please tell me your name, date of birth?
Nick Dabworth, August 25th, 2002.
All right. Well, nice to meet you, Nick. So Nick, today we're going to be doing a nose, mouth, and throat exam, which basically means we're looking at your nose, mouth, and throat, seeing if there's any blockage or anything that looks out of the normal. Is that all right with you?
Yeah.
Great, great. Okay, so have you ever had any sort of severe throat infection or some sort of big sinus infection that kept you sidelined for a little bit?
I don't think so.
No? No? All right, good, good. All right, are you coming with any pain today?
No.
No?
Okay.
All right. Patient looks upright, alert, looks stated age, looks ready to be assessed. All right, great. So starting off with looking at your nose. Your nose is symmetric. It's along the midline. There's no deformities, no masses or lesions, cuts, bumps, bruises, even really freckles or anything like that. Just a pale, good-looking nose. All right, now, could you tell me if breathing is harder out of one nostril or the other? Okay, all right.
Just a little bit.
Yeah, okay, cool. Okay, so right side nostril is more clear of obstruction than left side nostril. It is more patent. I believe that's how you do that. Now let me take a little peek up there, all right? All right. Okay, great. So nasal cavity is clear of obstruction, symmetrical, no deviation, no inflammation, masses or lesions, cuts, bumps, bruises, masses, lumps, anything like that. Okay. Now, have you gotten your wisdom teeth out?
I have.
You have. And have you ever lost any other teeth in any sort of accident or just
No.
anything like that? All right, great. Now, could you smile for me? Great. Can I see both sets of teeth? Great. Now open up. All right. All right. Teeth are, I would say the spacing is adequate. There's no real spacing in any of the teeth. Patient has 28 teeth. I check those teeth again. They are white with a tint of yellow. There's no real jaggedness in their layout, and the top jaw falls, or the bottom jaw falls in line with the top jaw as far as placement. Okay, now could you please open back up? All right. So, checking the buccal mucosa, tonsils, hard and soft palate, uvula, tongue. I said hard and soft palate. Okay, so there's no, you can close your mouth, thank you. So, no inflammation, there's no, you don't have any pain anywhere in your mouth, do you?
Mm-mm.
Okay, so, and gums as well. So the buccal mucosa is pink, symmetrical on both sides, clear of lesions or masses, cuts, bumps, bruises, anything like that. The gums, could you smile real big for me? All right, great. So the gums are not ridden back at all. The gums look healthy and regular, and they're pink in color, no discoloration, they're intact. The open real wide for me. All right, so looking at the tonsils, tonsils are intact, not look inflamed. Uvula is round, drooping, looks regular, no masses or lesions. Buccal mucosa, tonsil, you can close your mouth, thank you. Got a buccal mucosa Did that. Okay. Oh, let me go ahead and check your sinuses real quick. Okay. Okay. All right. Is there any pain? No pain. Okay. No masses or lesions, cuts, bumps, bruises, or other deformities. I already spoke to the gums, spoke to tonsils, uvula, buccal mucosa. Could you please, and your hard and soft palate. Your soft palate was rising. You stick your tongue out for me and say ah. All right, great. Tonsils constrict upon verbalization. I think that concludes that section. So looking at your lips, bottom lip is slightly fuller. They're clear of lesions or masses, cuts, bumps, bruises, or any sort of lesion or mass in that category. Hard and soft palate, I'm speaking to as clear, regular of masses or lesions. Now let me see that tongue one more time. Okay, all right, great. Okay, so tongue is symmetric. Could you lift it up? The underside. All right, great. So tongue is symmetric. You can close your mouth. Symmetric. No lesions or masses. The dorsal side looks rough, pink, clear of any sort of bad stuff. Underside is more red, veiny, and is clear of any masses, lesions, cuts, bumps, bruises, or anything like that. And the entire inside of the mouth and tongue looks to be moist, not drooling, and not dry. And I already spoke to the tongue, so I think that will conclude our nose, mouth, and throat exam. Do you have any questions for me?
I have no questions.
Great, let me go ahead and wash my hands one more time. Yeah, and everything looks good. Everything looks good. So
Thank you.
thanks so much for coming in.
Of course.
Nice to meet you.
Nice to meet you as well.
That concludes